This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Mr. John, a hard-working farmer in his late 40s, lived in a small village on the outskirts of Abuja, Nigeria. Known for his honesty and resilience, he had spent years providing for his family of 5. Life wasn't luxurious, but it was content. That was until the day a persistent pain in his lower abdomen changed everything. Initially dismissing it as a minor ailment, Mr. John resorted to home remedies. However, when the pain intensified, he reluctantly decided to visit the nearby government hospital. It was an institution he had always associated with affordable healthcare, though its reputation for efficiency was less than stellar. Upon arriving at the hospital, Mr. John was greeted by a sea of patients waiting in the overcrowded reception area. After hours of standing in line, he finally registered his case. The nurse at the desk barely looked up as she asked, "What's the problem?" He explained his symptoms and was directed to wait for a doctor. Hours turned into the better part of the day before his name was called. Exhausted, Mr. John entered the consultation room, where a young doctor glanced at him briefly before scribbling notes. The doctor barely listened to his symptoms and ordered a series of tests including x-rays and blood work, which Mr. John was told to pay for immediately at the cashier's office. The fees were steep for a government hospital. Mr. John hesitated, explaining that he could only pay part of the amount up front. The cashier, a stern-faced woman, curtly informed him that services wouldn't proceed without full payment. Desperate and in pain, Mr. John borrowed money from a relative and settled the bill. The tests were conducted in facilities that appeared poorly maintained. The staff showed little empathy, and Mr. John felt like just another number in their endless stream of patients. Days later, he was called back for his results. The doctor, with an air of indifference, informed him that he had kidney stones and would need immediate surgery. The estimated cost of the surgery was far beyond Mr. John's means. Distraught, Mr. John begged for alternatives. The doctor recommended a payment plan but insisted the surgery was urgent and delay could be fatal. With no choice, Mr. John scraped together his savings and borrowed further to make the initial deposit. He was admitted the next day. The surgery was conducted in a dimly lit operating room, and the recovery ward was overcrowded and understaffed. Post-surgery, Mr. John's condition worsened. His abdomen swelled and his pain persisted. Despite his complaints, the nurses dismissed his concerns, attributing them to post-surgery discomfort. When he demanded to see the doctor, he was told the doctor was unavailable. Fearing for his life, Mr. John contacted a friend in a nearby city who advised him to seek a second opinion at a private clinic. Mustering his remaining strength, Mr. John discharged himself against medical advice and traveled to the clinic. There, the doctors were shocked at his condition. After thorough tests, they revealed that he had never had kidney stones. Instead, he was suffering from a severe urinary tract infection that could have been treated with antibiotics. The so-called surgery was unnecessary, and the complications he was now experiencing were due to the botched procedure at the government hospital. Devastated, Mr. John realized he had been extorted and subjected to medical malpractice. The private clinic treated him with compassion and proper care, but the financial and emotional scars ran deep. He had spent his life savings and accumulated debts for a surgery he never needed. Determined to prevent others from suffering a similar fate, Mr. John took his case to local authorities and the media. His story sparked outrage, shedding light on the corruption and negligence plaguing many government hospitals in Nigeria. Though his fight for justice was arduous, it ignited a broader conversation about healthcare reform in the country. Mr. John's ordeal serves as a somber reminder of the consequences of systemic failure in healthcare. His courage to speak out, however, became a beacon of hope for others, pushing for accountability and change in a system long overdue for reform.